Out today.
Ladies and gentlemen, can I have everyone's attention? And we're on the air live. Welcome to a staff meeting today. We're going to talk about several things that impact our budget, and it's important that we discuss those today because the manager is going to be preparing his manager's copy of the budget here to present to us in the near future. But we have several things that we need to discuss today. First of all, the C.J. Lofton Task Force is very important. At the end of this, you'll see that both the city and the county are going to put together a joint dashboard for the different items that came out of the task force recommendations. We're also going to talk about some requests from other organizations, especially the Mental Health Substance Abuse Coalition. I also want to welcome in the audience Councilwoman Becky Tuttle. Welcome. Thanks for joining us today. She is involved both in the task force and the Mental Health Substance Abuse Coalition, so I appreciate her attending the meeting today. So, Mr. Manager, do you have anything else before we start the meeting?
No, Chairman, you took my job of announcing the topics, but thank you for covering that. If you're ready to start, we'll go, sir.
Very good. Well, I appreciate it, and I think Rusty Leeds is going to...
I'll start.
You want to start? Okay.
Let me just kind of go back to chapter 1 of the book here. We are going to discuss two main topics today with a third ancillary topic. The first topic we're going to discuss is the task force recommendations from the Sedgwick Lofton task force. And for those viewing, I just want to kind of summarize the history of this. Mr. Lofton, as I think is well known, died in custody at Giac after a series of events back in September. Starting with a police call, actually even before that, starting with mental health crisis within his home with his foster parents, which then led to a trip to ComCare, and he ran from ComCare, then showed back up at his home, which then led to a police call and a police intervention, which then led to a transport to Jayak, and he died in that custody down there. So after that happened, it was fairly clear that clearly there was some system issues we wanted to take a really hard look at. And the best way to take a look at those systems issues was to involve the community and be transparent and sit down, and this is how this task force was formulated. They met through what we had initially planned to be about 6 meetings, turned into about twice that. They met many times, had a lot of discussion, and what we're seeing today, and what the Commission's already been provided with, is a list of recommendations that this task force has put forward that deals not only with the county, but with police conduct and with foster care system and everything that touches juveniles. What we're going to focus on today in this Lofton Task Force summary is those that impact or could impact county budget. And it's timely to do that, and we appreciate the task force's timely work to get us this information so we could consider it in a 2023 budget consideration. So what we'll have today is a list of 14 budgetary types of asks from the task force. That is by no stretch of the imagination their total list of recommendations, but it is those that we glean through and determine could have budget impact. So we're going to cover those in some detail today. The Mental Health Substance Abuse Coalition is a group that has been meeting for years. We had an en banc a couple, 3 months ago where we talked about their summarization and the document that they produced. We have gleaned that document and come up with what appears to be some budgetary recommendations on the county side that we will also go through today in some detail, though not as great a detail as the Lofton Task Force, but we will cover those. And the mission of today is for the Commission just to hear this. I don't know that we need decisions today. We will be meeting with all of you individually next Monday and Tuesday to help me finalize my recommended budget to you. And of course, you know that after you receive my recommended budget in July, you can still go through and make modifications and changes to the budget as the commission before our ratification in August. So there's opportunities for change of budget at this particular time. And so really what we want you to do is hear the facts today, question staff, and we'll answer as best we can. I do want to mention that these are the task force recommendations. These are not staff recommendations. These are coming from the citizen group. So, but we as a staff will try to answer as best we can any question that the commission may have. If we could flip to the next page, and this is a busy page, and for those that are watching online, don't worry about it because these will come up individually as we go through the discussion. But on the left-hand side is the list of 14 requests that could have budget impact from the Lofton Task Force. Rusty will talk us through these, and they're really divided into 5 kinds of categories. One is community engagement, let me start at the beginning. One is mental health response, one is compensation and workforce, one is training, one is safety and security, and the other is community engagement. So there's 5 broad topics that all of these 14 will fit under, and Rusty will step us through those in some detail. He has with him today Alora Forshee is our 911 director, because some of these asks deal with her department. And he has Chris Morales and Steve Stonehouse here from corrections, because many of the asks have to do with corrections kinds of components. And then I'll talk about mental health substance abuse coalition when we get to that point. So with that, Rusty, I will turn it over to you, and you can step us through the Lofton Task Force findings.
Well, Rusty, welcome. First of all, as you go through the different themes, stop at the end of each one so that we can get feedback from the board before that you go on to the next one, okay?
Yes, sir.
And we may stop you in between if lights come on and they got a question on one of them you're talking about.
Yes, sir.
Thank you.
Okay. Chairman and Commissioners, Rusty Leeds, Assistant County Manager. So as Mr. Stoltz indicated, first we're going to look at the Community Task Force and then the coalition. I would state as we go into these that some of these items that you're going to see are dependent upon staffing. Some of these call for actions that, if we are not adequately staffed, it's very difficult to be able to initiate these. And as we've indicated, compensation is a priority so that we can get staffing back to a level where we can provide a level of service that would fulfill some of these requirements. So as these come up, there are some asks for FTEs and some others that impact staffing levels in order to be able to implement them effectively, which include increases in training. There's some recommendations to increase training or have regular intervals of training. Some of those trainings can be facilitated if they tie into the regulatory and statutory minimum training requirements, but if they're above and beyond that, they may be deferred at least temporarily until we get staffing levels to a better position. So with that, we'll begin with the 14 Community Task Force recommendations that we have identified that have some potential budget impact. Okay, so the first theme, as Mr. Stoltz indicated, we took these 14 and we broke them into themes. They will appear in the same order as they are on the big table, but they've been broken into themes. So the first theme is mental health response. Item number 1, develop and fund a 24-hour mobile health response. So the task force recommendation here was pretty broad. They mentioned ICT-1, and they also mention and acknowledge the mobile crisis unit. Both of those exist presently and are staffed in a way that they are able to provide response in the community, but not necessarily 24-hour coverage based on current staffing levels. But the task force also, as part of the recommendation, did not tie us only to those two. They want a 24-hour response, and there's a lot of models out there across the country. And so we have the opportunity to look at many different models and see what fits best. With that said, the number that you see before you, 745,536, talking internally, at least tentatively, the recommendation to go 24 hours, 7 days a week would be to increase the mobile crisis unit at ComCare. Again, this is one of those items that is dependent upon staffing. But it's a cost-effective way to ensure that we have 24-hour-a-day, 7-day-a-week coverage with mental health clinicians who can get out to people in the field as is necessary. That number includes the cost of staff. This would increase the number of mobile crisis unit teams from 2 currently. It would add 4 more teams, so that's 8 FTE at a cost of about $707,000. Adding that staff and being available to be in the field 24 hours a day, 7 days a week would also really require an additional vehicle. So with the vehicle and the set-aside cost to support that vehicle, that pushes that first-year number up to $745,536. And that obviously is not currently funded, and it is a pending recommendation. If Tim has something he wants to add,
Okay, just to clarify, this is not ICT-1. This is using our mobile crisis and just expanding that. And it's a 2-person team.
currently that would be the recommendation. As you're aware, ICT-1 does exist, and there was some, we have numbers that associate with that. They were put together for the coalition to present at an en banc recently. But to try to get to close to a 24-hour-a-day, 7-day-a-week response with ICT-1, with the multidisciplined approach of a police officer, a paramedic, and then a ComCare or a mental health clinician, it reaches close to $1.2 million. And that doesn't really get us to 24-hour coverage. That gives us 7-day-a-week, 20-hour coverage at that price tag. The approach using the mobile crisis unit puts clinicians in the field responding to police requests, responding to EMS requests, or fire requests for assistance with mental health, and then also just responding to families who are seeking help for somebody who's in crisis at the moment. So,
and to clarify one more thing, that 8 FTE, that's difficult to come by right now because the last I heard we're right at 200 short in ComCare currently, correct?
Yes, sir, that's correct.
So we need to fill the 200 short that we've got, and then try and find at that point the opportunity to fill 8 more if possible in the future. But that's why this says it's pending, correct?
Correct.
Very good. Well, my lights lit up, so we're going to hold on. We'll go down the line. Commissioner Howell.
Thank you, Mr. Chairman. Just a clarification. This is 8 new FTE, correct, for 4 new teams?
Correct.
So we're going to go from 4 FTE currently to 12 FTE for this program, right?
Correct.
And you mentioned this is not ICT-1, and so the difference is this is 2 people from ComCare going out together by themselves, no physical assessment, and no police support unless they call for them.
That's correct.
Okay. And 745. You know, it's interesting. A couple of years ago, we talked about expanding this ICT-1 to 365 days and 24 hours a day, and I estimated $3 million. That's the total cost. Is this 745 just for Sedgwick County only, or is this going to be shared with Wichita in any way?
This is a ComCare program. And
ComCare
so this
only.
would be ComCare, 2 ComCare staff, 1 licensed therapist, and then 1 skilled case manager. These are ComCare staff.
If you did ICT-1, you mentioned 1.2 million. Would that be shared between Sedgwick County and Wichita if that was to be the option?
So the 1.2 million would be on top of what the currently we run one team.
Right.
The current cost with the vehicle cost included is around $350,000 a year.
Right.
So the 1.2 million would be on top of that, and that would include, if it continues to be configured as it is now, a portion of that would be the Wichita Police Department's cost for the officer, and the rest of that would be the county's cost for the paramedic and the clinician.
And I think to do the 365, 24 hours a day, you need about 5 teams to do that, right?
Yes.
So 5 times 350 gets you up there. Anyway, but that would be shared between Wichita and Sedgwick County.
If we remain
do that.
configured as it is now. That's
Has
correct.
Wichita been asked what they want to do here?
Yes, I've spoken to the chief of police for the Wichita Police Department. They are looking for a solution just like we are.
Yeah.
And they are presenting some information to their city council regarding staffing mental health clinicians in the field to co-respond with officers is kind of how they envisioned setting it up. But they also have been in conversation with ComCare and with our director from 911 and with EMS. They've been having that conversation jointly between those 4 entities as they work towards some solution to have clinicians available to them to reduce the amount of time that they spend transporting to hospitals or comm care whenever they encounter mental health.
If a physical health assessment is needed, can they call for a paramedic to do that assessment in this model? Or is that something how do they do that if it's necessary? How do they do a physical health assessment if it's necessary?
If they believe that's necessary, they're going to call 911 and ask for EMS dispatch.
So just to clear, again, going back to the coalition's meeting last, we had at WSU recently, they said 2% of the time they call for a police backup of some sort on these types of calls. So 98% of the time they don't need that. I want to just tell you, this vindicates my CAB board. They essentially said this is the model to follow for efficiency and effectiveness. If you want to get this out there, you've got to find ways to do more with less. This is a better approach. I like ICT-1 if you have the money, but if you don't have the money, this is a way to get mobile mental health out there in the field where it needs to be, using EMS as needed and using law enforcement as needed and getting those professionals from comm care out there. This is a much better way to go. So this is a great proposal. Thank you, Chairman.
But again, I do not see this going in our budget for this year because we can't even staff 200 positions. Adding 8 more doesn't make sense to just put on our books because it can't happen.
I somewhat agree. However, if we have folks that are at ComCare that can take this role, it might be better to have some folks that can do mobile mental health versus in the office type of mental health. So I'm not saying we can't find them. I don't know we can't. We are definitely short. But where the priority is, I think we've talked about mobile mental health as a priority for the community. I almost have to fund that first, in a sense, before other things, because this has ramifications on all kinds of other stuff. So in terms of if you only have so many positions filled, these might be a priority position over the other positions. But I do see your point. Thank you, Chairman.
Thank you. Commissioner Cruz.
Thank you, Chairman. Tim, so how will these calls be triaged? Will this be the 911 calls, or these will be triaged through the 7500 number?
Through the ComCare call center.
Okay, so how do we plan to incorporate those two things in the future with the 988 number as well?
The 988 answers, the folks who answer the 988 calls are the folks who answer the 7500 calls.
Okay,
Yeah.
okay. And so this will be a total of 6 teams?
Correct.
Okay. And then you said it was a clinician and a skilled case manager, so 2 folks. I think those are all my questions. Thanks.
Thank you. Commissioner Lopez.
Okay, thank you. Well, you really hit on it, Chairman. Thank you. I just wanted to point out that, or to have the discussion about the workforce shortage issues that we're having in ComCare right now. And while I think that we can look at what's a priority within ComCare itself, I think for this conversation right now, it doesn't make much sense to add this into our budget for this year, just because we don't have the staff to staff it as it is. So for the 2 teams that we have now, how many FTEs should we have currently, and do we have that many to staff it full-time as it is?
It would take 4 staff, and we have 3 of those 4 filled and 1 very close to an offer on the 4th position.
Okay, well, that's good to know. I'm glad we have an offer on the 1. So I think that if this was just a budgetary issue, this would be much easier, but because it's so complicated with the workforce challenges we're having, that it's just something that we'll have to work towards. And I think it just reiterates why compensation has to be our number 1 priority going into this budget, because we have to keep our staff and then get new ones as well. So, thank you.
Correct, but one more thing we need to consider is that we are trying to work through this 200 staff positions that we're down. We're offering bonuses right now. We're looking at reclassification so that we can raise the pay. We haven't voted on anything, but we may have a mid-year pay raise coming up. So we're doing as much as we can right now, trying to entice folks. This morning I was in a meeting with the Greater Wichita Partnership, and the discussion during the entire meeting really was around workforce. It's not an issue just here at this county. It is across the board. I listened to the folks from Textron, from Beach, speak about the difficulties of getting the workforce that they need for tomorrow. So we need to continue our efforts and find ways that we can pay rates that are marketable. But we're still going to face some problems in the future. This will not be solved in one budget cycle. It probably won't be solved in 2 or 3 budget cycles, but we will work towards solving it. Oh, Commissioner Cruz.
Thank you. I remembered another question. So have we asked our staff how this is going to impact them and how they are going to manage their operation? I mean, we can sit up here all day and talk about how staff should be funded, but I'd like to hear from Jennifer Wilson at the Crisis Center. I'd like to hear from the boots on the ground folks that are actually doing this work and see what will help them the most be more efficient with their operations, care for the highest need in our community. Those are the types of questions that I'd like to have answered. And then additionally, like the systems that they're working with, you know, we're still filling out paper. We're still filling out paper intake forms. That has to then be given to a staff member to then input. So are we looking at systems that will create more efficiencies for our staff to allow the staff that we have here to work quicker and be more efficient with that? That's something we need to talk about.
Commissioner Howell.
Thank you, Mr. Chairman. Just, this says status pending. Can you please explain what that means?
That was my word selection. It means that no decision has been made.
Pending sounds to me like it's kind of planned and we just haven't quite got there yet.
I used the definition of pending that meant there was no decision made and no action is being taken. That's how it's being used in this context.
I think we also need to clarify a point here that we're about 200 people short in the ComCare organization right now. We've been short the entire time I've been a commissioner. I'm in my 8th year. So we're not going to have full staff before we get to the point of funding this. I think we have to decide in a list of priorities, if you hired 5 more people, where would you place them? You might put some of these folks in this position rather than trying to say you have to get 200 people hired before you can start to fund this. I guess my point is I don't see them as one as a prerequisite for the other. I think you have to prioritize what's the most important spot for the next person to go. This might be the place. All right, thanks.
Well, I don't see any more questions on that. You got about 30 some more items to hit, and we've done one, so.
So item number 2 expounds upon what we just talked about. The recommendation was to embed a qualified mental health provider within 911 system. And the way that expounds upon number 1 is you asked the question about how these people are sent to a call, sent to assist somebody. By embedding a mental health worker in this 911 system, an example, there's several communities out there that have done this. Dallas, Colorado Springs, Austin, Texas. Dallas is one where they have a licensed behavioral health clinician in the 911 center, and the purpose is to help those call center call takers when they get somebody on the line who's in mental health crisis or has a family member there that's in crisis. They get on the line, they triage, they may do some conversation with that person. They may be able to resolve some of that over the phone without having to send police, but if they make the determination on what the best referral is, and or Dallas has a field response unit, it's more ICT-1 structured, but this clinician in the 911 center can then make the referral to that group, send them to this person's home. I apologize. Send this to that person's home and have them work with the person. So it kind of expounds upon that, whether it's an ICT-1 type program or whether it's the mental health crisis or the mobile crisis unit. If a call comes into 911 center, that clinician can reach out to ComCare and make that referral and get them sent out in a timely manner to that patient. So that's what that recommendation is. The cost on that of $77,264 is using the assumption that this would be a bachelor's level clinician. In Dallas, they use a master's level, but I know that Director Forshee, some other public safety directors, and ComCare have been having regular meetings for several months now where they're looking at these types of programs, understanding that we need to step up our game in Sedgwick County and make mental health another call type in the call center with resources hopefully in the future in the field that can respond to those as opposed to fire, EMS, or police whenever it's appropriate. And so that group has been working together. They're currently in the process of data collection and analysis so that they can really work out and determine what the best level of clinician would be in the call center, and how that system would work here in Sedgwick County. And Laura can expound upon that if you have questions. We aren't to the point of launching a pilot on that yet. Again, they're in data collection phase, but this was a recommendation that was made, and that 77,000 represents a bachelor's level clinician if that time came, and that's the level we chose.
But that's not 24/7.
I think that the intent would be to initiate a pilot, get acclimated to how that works, and then determine expansion from there. Obviously, the cost is going to depend on the level of service we want in this community. If we want 24-hour service, then you're talking about 4 to 5 clinicians, 24 hours a day, 7 days a week, to take about 5, so it'd be 5 times 77. Or if it was determined it was a master's level, then that would be 5 times 100,000.
Okay, Commissioner Howell.
You just made the exact point I was going to make, that I think that we're only talking about 1 versus 5. I think if we're really going to do this, it needs to be 5. There's an asterisk on these first 3 lines here. What's the asterisk mean?
That asterisk means that there's just more to the story. That I wanted to clarify that number. That's one person. 77,000 is one person. So
Right.
that asterisk was for me to say, if you spend 77,000, you're not going to get 24-hour coverage. That's just for one person.
Okay.
So that asterisk is kind of my
So
note.
two related questions. These folks that do 911, they are excellent. They can talk about how to deliver a baby, how to do CPR, all kinds of stuff. Do they get some type of training on how to handle a mental health crisis? Seems like they should have that baseline. And I think a second question I'll ask at the same time. I thought we had a service out of Arizona or somewhere we were doing handoffs to someone who was basically take that type of a call for us.
So there was a grant application last year for a nurse line, and that was through the ComCare. That was through the Centers for Medicare Services. They ended up withdrawing that grant. They did not have enough applications, and so therefore they issued no awards on that. So we did not have funding. And that was about $1 million price tag on that.
In terms of efficiencies, if you have someone who has a skill set that you can hand off at 2 o'clock in the morning, we may not actually have to have the person in our facility. It might be someplace elsewhere that can do this for numerous jurisdictions. Just a way to do more efficiency. But go ahead, please.
Sure. Elora Forshee, Director of Sedgwick County 911. Yes, our staff is trained to take mental health calls to provide a really baseline level of support of what do you need, what resources can I get you, what's going on there, assessing the situation, and then determining a response. The issue we have right now is our response is really just police, fire, and EMS. The other issue we have is that we have a lot of calls coming in and not time to sit on a phone and really go through what resources are available, to do a deep dive into assessments of the person to see if there's other resources that are appropriate. And that's where that handoff would be, is allowing that deeper dive, that more in-depth look at the mental health situation there, and then more appropriate resource matching.
All right, thanks.
Thank you, Laura. Okay, I don't see any other questions on that line. We've got through 2.
Okay. Number 3, provide for core mental health services that support Giac. This particular request is one that is funded and can be implemented pretty quickly. The IP stands for in process, so it's something that we're working right now. In this case, Department of Corrections made application and was awarded some evidence-based funding dollars from the state through the Team Justice Board in order to place, or in order to provide that mental health core service in Jayak. That money begins July 1, and it will fund that service through June 30 of 23. If the grant does not become available again for the following state fiscal year, then we would either have to absorb that cost in the corrections budget, or potentially there's a potential that there's going to be some contingency money, and Lindsay may not like me saying that, but we would have to find a funding source for the second half of next year if the grant did not come through a second time. The cost of that, the grant award was about just shy of $138,000. Chris Morales has estimated that the cost will be around $150,000, but I'm assuming that we can absorb that extra amount in the budget if there is an extra amount there. So we believe we have that request covered, and we have a grant that will cover it for at least a year.
Very good. Next item, please.
Okay, provide trauma care services for youth while in Giac. and then follow-up treatment whenever they leave the facility. There's a 0 there, and it's in process. This particular item will be covered through, you recently approved a contract with a vendor that will provide medical medical services at JDF and JRF, and Giac is part of that facility. That medical contract will provide this service. They will provide this service for Jayak, JDF, and so it's already covered in the cost of that contract. It already will have the staff available to do that. And same thing for number 5, ensuring reliable levels of service for remote and virtual access. Again, this will be covered by that contract. Additionally, if on both of those items, number 4 and number 5, CommCare also has some level of capacity to provide those services. On number 4, once the child is released from JDF or JRF, if that service needs to continue in the community, CommCare is a resource that we can send them to for that. And then on number 5, the telehealth portion of that, or the remote teleconference or consulting part of that, CommCare can also provide that service if we need something in addition to the medical contract that we have. So all of those are considered to be in process, something that's going to get done, and they either have no cost or the cost is already covered in contracts that we have.
Very good. So in summary, on the first page, 3 of them are in process currently, and the other 2, we need to talk to Jennifer Wilson and Tim Kaufman to see how that fits into the overall 200 slots that we need to fill, and what priority that we fill those 200 slots.
That's correct. Currently, there's no funding, identified funding, and there's more work to do.
Okay, Commissioner Cruz?
Tim, can you tell us what core mental health services are? Can you list those out for all of us to know?
I'm not able to, since this was a request from the task force. I don't know what they had in mind. I assume that they were talking about assessment and probably therapy, potentially post-release case management, and then medication management and medication services as well.
So I guess I'd like to have a list of what their expectations are and what our definition of it is, so that we are on the same page with what core mental health services are for both entities. Can we find that out?
Yes.
Okay, thanks.
Okay, we'll go on the next item, which is compensation workforce.
Okay. Number 6, improve pay and increase diversity in 911 staff. So the number 83,900 is a number that you've seen recently in compensation discussions. You were provided a document with some tables the other day, and on that table it showed that the 22 net impact to improve compensation in 911 for the final quarter of this year, that would be the net impact 83,900. It's not necessarily in the forecast, and it hasn't come before you for final approval, but it was brought up to you in some of these discussions we've had. So it will be worked a little bit more. It's in process, but it's not yet approved and funded fully. And we will be having some conversations with the director of 911 this coming week, and with HR and finance to iron out the details, and then Sheena will come back to you with more information on that.
Okay, Commissioner Howell?
Thank you, Mr. Chairman. Just being a wordsmith here, what do you mean by increased diversity in this position? Are they not diverse now? Or are we doing something specifically to draw certain types of people? What are we talking about?
We are. Diversity, it's critically dependent upon the recruitment and retention strategies of both the county as a whole and as the department. Laura, if you wish to speak to it, you can. They are active, and they work hard to diversify their workforce, and I'll let her speak to that a little bit if you wish.
Yes, again, Laura Forshee. In thinking back to the conversation had with the task force on this, we talked about how it's really important for different cultures and different communities to be reflected in their emergency services. One issue I have is that we are predominantly white on our staff at 911, and I think that I would appreciate more diversity in our staff, more reflective of our community, and making sure that when people call, they hear a voice that sounds familiar and similar to them and is able to speak to those cultural differences that we have in our community. So how we do that is tricky. We've talked about trying to get into different facets of the community for job fairs and for job postings. You'll see another recommendation on here for a community advisory board. And I think that community advisory board could really help with determining the path of creating that diversity within 911.
Community advisory board for,
For 911.
okay. And I guess my point is, if someone comes to you, they're qualified, they want to be a 911 operator, you're not going to turn anybody away.
Not with the number of positions I have open, no.
Yeah.
No.
So I think getting information out to certain parts of the community is not a bad strategy, I suppose, but I would like to be very clear, we're not rejecting anybody who's qualified. They want to come and do this, and they can do the job we want them.
No, I guess in my understanding, diversity doesn't mean I'm rejecting anybody. It's making sure everybody feels welcome to have a seat at the table. And so that's what we want to make sure that we have.
And this is a cost of $83,900. My question is part of that money strategically geared towards the diversity component of this statement here?
That is all geared towards compensation in my
And
understanding.
so there's no money tied to diversity. See, all this $83,000 is for pay, not for diversity.
Correct.
Thanks.
Okay, Commissioner Lopez.
Thank you. Laura, thank you so much for speaking about the community advisory board that you're looking into. I think that's a fabulous idea to get some of that addressed. But we are doing a lot for DEI work within the county, not just focused for 911, but really focused on countywide. So we have hired Hicks Carter Hicks to come in and do some surveys and look at policies and procedures and how we can do better about being more inclusive intentionally within our community, within the county and externally, and how we're looking at hiring people and those practices as well. So I do think it's important to mention that there is significant work being done to diversify across the board at the county, not specifically just within, like I said, 911, but just across the board. So anything that like an advisory board that looking into that as well, I think is just an added bonus. So thank you so much for doing that. I actually just graduated from Advanced Kansas today, which is all about diversity, equity, and inclusion. And a quote I heard was, "Excellence requires diversity." And I think you hit on that topic exactly, because if you have someone calling in, having some kind of resemblance of what they know is going to be extremely important to allowing people to open up. So appreciate all the work you're doing there, but I just wanted to make sure that we made it a point that that is being worked on. And then we, within 911, have bonus pays, critical pay still, and then going into this coming budget, but then finishing this year, there's going to be significant wage increases. So we are addressing number 6, I feel pretty good right now. Thank you.
Commissioner Cruz.
Thank you, Chairman. Laura, could you speak to the language barrier in which that we might face? How are we making sure that those who have a language barrier are still served in the same way?
Sure. So we do contract out with a language translation service, and that's good. It's not, to me, the best approach to that. We still have to take the call, get a translator on there. We're going through a third party. There's all that. So we do offer some pay increase or pay incentive for those that are non-English speaker, or not non-English speakers, bilingual speakers, to be in dispatch to help serve those communities. But that pay increase is something we've kind of concocted within our pay system at 911. If we're looking at ways that we can increase diversity, that might be something to look at the county-wise. How do we compensate those that are bilingual and provide that service to communities and not have to have this third-party vendor?
Sure. Thanks so much.
Mm-hmm.
Thank you. Okay, Rusty, I think we can move on.
Okay, number 7, increase the number of mental health professionals in Sedgwick County. And so this ask is really about increasing the number of practicing mental health professionals within the geographic boundaries of Sedgwick County, not necessarily just ComCare, but within the county as a whole. It's my understanding, and Mr. Kaufman can speak to it, there was Mr. Kaufman worked on submitting a Spark application for about $3.5 million, hoping to get some funding into Sedgwick County for this purpose. It's my understanding that Spark request probably has been reviewed and is not likely to be funded. Otherwise, there are some other initiatives which you're more familiar with, partnering with the KU Med School to try to attract those types of services into the community. But right now, this is really a broad request from the commission that there is no funding available, and there really aren't any specific answers as to how we attract and bring those types of skills into the county, both in the private sector and in the public sector.
Well, good. Well, this is one we've been working for some time, and it can't be solved overnight because most of these positions require a bachelor's or a master's degree in order to be able to do it, in some cases a doctorate degree. But we are looking at it. As you mentioned, we just got a briefing here a week or so ago from the KU Medical Center, and they are wanting to add a fellowship for psychiatrists. And hopefully we do support that with some ARPA money to be able to kickstart that. It's a 10-year program that will turn out a number of new doctors that'll work psychiatry. The other area that we're working on in that is that we've all had discussions with Dr. Muma and Andy Schlapp, and what we're looking at, the things that are happening at WSU are truly transformational, especially things like the new Health Science Center, so that if the projects that are happening out at WSU right now are really geared, very innovative, and that is actual having practical experience in all kinds of areas, whether it's manufacturing or, in this case, healthcare. So what we're looking for is applied learning to give them practical experience, and being able to co-locate our new ComCare Crisis Center whenever that we get to that point with the new Health Science Center, so that we're able to have applied learning going right down through. And then when they graduate, those individuals, they've got that applied learning right here in Sedgwick County, and we can put them to work right away. So it won't be solved overnight, but it's something that we have several projects that we're working for. So I feel comfortable in the future. I don't feel comfortable today. Commissioner Cruz.
Thank you, Chairman. So like the request for number 3 with the definition of core mental health services, could we get increase the number of mental health professionals? The list, I know that this is from the task force, so it might not include things like addiction counselors or peer support specialists, but those would be included in mental health professionals. So could we sort of drill down with what their expectation of mental health professionals are? Because again, those could be 2 different lists. Thank you.
We can, and I think I'm hearing a flavor that we may want to go back to the coalition with some of these questions. This one is a difficult one. We've talked a lot about this because it doesn't just deal with Sedgwick County government, it deals with the community. And that's why it's such a hard task to try to increase the number of professionals of any profession within a population. So we'll go back to the coalition and have them drill down on specifically what they were intending.
Hey, Commissioner Lopez.
Thank you. Well, I appreciate you bringing up the Health Science Center, because I think that's going to be critical in looking at this in the future. I mean, obviously this problem wasn't created overnight, and it's going to take many years before we can actually fix this. I mean, what we're seeing now with our workforce shortages in ComCare is proof of that. So I think I'm glad that the commission is on board with helping and supporting the Health Science Center in any way we can, but I hope that we are able to continue to push that forward, because I think that is critical in addressing this one specifically.
Thank you. All right, Rusty, it looks like training.
Okay. Item number 8, add a continuing education coordinator to 911. The cost to add that position is $75,126. The director of 911 had submitted a decision package for the 23 budget cycle to be considered. The task force, since the task force had made the recommendation, currently, obviously, that is still in process or still pending. That budget, or we're still in the budget cycle, and we haven't made any decisions about new positions or funding for that. But it is available there for you to consider. Adding this position would allow largely the opportunity for emergency communications to provide continuing education for their incumbent staff. They have one individual who manages onboarding and hiring and a lot of other duties, but then trains those new hires. And then whenever those call takers reach a point where they're ready to be trained to be dispatchers, that person is responsible for that training as well. This new position would allow those employees who are sitting out there needing continuing education to better enhance their skill level, their knowledge of new industry developments. That trainer would help with all of that, as well as training field training officers. They may not be what they call them, but when they get those new people on the floor, they got to have experienced staff that train them up on the console, real life training. And those folks need additional training to be good instructors. So that's what this second position would do. It was recommended by both staff during a departmental environmental scan or assessment, and then it was recommended by the task force. So again, the cost would be $75,126. Right now, we're about 27 positions down there, but as we continue to hopefully reduce the number of openings over there, at some point it will be appropriate to add this position to start providing better training for the incumbent staff.
Well, again, it's one that needs to be prioritized in the list of the 27 positions we've got open. It may not be the first priority, but just adding an FTE when we're already 27 down doesn't fix our problem. What fixes our problem is hiring some of those 27 positions and then prioritizing the hires to figure out which one of them would possibly be a training individual. But I guess I'm not, and I spoke to this when we were doing the budget hearings, I do not understand adding FTEs when we can't even fill the FTEs we have. So we've got to prioritize our hires and figure out where those go, rather than just putting a bunch of FTEs on the budget that we then have to figure out how to budget for. So, Commissioner Cruz.
Thank you, Chairman. So Sheena, if you wouldn't mind coming up, can you tell us about our continuing education training that we have here at the county? Is this something that HR could work on, or how do you guys handle continuing education? Is it by department only, or is there some global continuing ed that HR encompasses?
Okay, thank you. Sheena Schmetz, Chief Human Resources Officer. The training that we have available through Human Resources would just be general topics that are available to all employees, so they are not specific to any one department. I don't know specifically what 911 specifically would need in their department, but it wouldn't be something that we would direct specifically to them.
Okay.
I don't know if you want me to speak to that or not, or what
Sure.
the difference would be.
If you got something to say, we'd love to hear it.
I always got something to say. So yes, we do utilize that HR training in that they have great topics that we send mostly leadership staff to, but then those looking to go on that leadership track. But these are things really specific to 911. So the question that Commissioner Howell had earlier about how do we train staff to deal with people that are in mental health crisis. So you come through the academy, and while you're being inundated with all this information, we're going to talk to you about, okay, if you have a suicidal caller, these are the things that, what we want to get out of that, how to provide that support, all that good stuff. And then you get out onto the floor and you're actually doing the job, and you really need to have that reinforced pretty periodically. Active shooters, we're getting ready to do more active shooter training because with everything going on in our world, it's just inevitable we're going to have an active shooter. So those are the things that doing that continuing education past that first point where they're trained in that in the academy, we've got to go back on some of those topics. And some of them are just repetitive, that it's not that the training changes so much, but they need to be hit on because thankfully they're not events that happen all the time, but they need to be hit on so that it's fresh in their mind. And then some of them are things that change. I keep bringing up Narcan in our community and the overdose crisis and the drug use crisis that we have. When we have people calling up saying, my child's overdosed, I've got this Narcan, what do we do? We've got to be responsive to that and know how to address that situation. So those are things that we would train in-house and not look to HR to do.
Okay. So one follow-up question, though, too, about the implicit bias training that's next. That would be a global type training. How does HR plan to handle implicit bias training?
So we will be working with Carter Hicks on how we can implement not only training for new employees, but annual training for all employees in regards to any discriminatory or bias training.
Okay, so this $11,000 is strictly for Giac.
Yeah, we'll get to that in a second. You jumped ahead of us, ma'am.
I did it. Sorry.
right.
Sorry, not sorry.
Thank
you, Sheena.
Commissioner Howell.
Sorry, not sorry.
Thank you, Mr. Chairman. I would make a point that countywide, not just for 911, but countywide. We've talked about, when I first became a commissioner years ago, we talked about a continuing education program for the entire organization, not just for an agency. This is a bigger problem than just one agency. I worked at aircraft companies. I was in the military, and they have programs set up to encourage people to enhance their skill set and to advance their careers, and they support that, and we should do that as well. But if we're going to do this for one agency, it really isn't. It's almost not fair to consider that every other agency out there under the county umbrella has the same need. So I have a bit of a problem just selecting this one to do this.
Yeah, let Sheena talk to this a little bit too, but there's two kinds of training. There's the global training, the holistic training organizationally that we do routinely for, and I'll back this up a little bit too. It all kind of depends on staffing because there's two components of training. There's the delivery of it and there's the cost of it. Then you have to have people to run your operations while you carve out a certain percentage so they can go to training. And that's our main struggle. One of our main struggles right now is we're so short of staff. In Alora's shop, for example, where she's so many bodies down, can she really carve out one or two people a day to go to training? Answer, no, not yet until she gets more healthy from a staff perspective. But we'll always offer the global trainings for leadership and for diversity and bias and all those kinds of things that stretch across the border. But within each department, you'll always need technical training too of what you do hands-on that day in your work assignment. All departments have to have some type of training internally. And I know Sheena works with departments, but the trainers come from within that pool of those workers. So Alora will figure out when she gets to a certain staffing, the chairman raised this before, she doesn't have to get 27 bodies back before she carves out a training position. She'll do that when she feels comfortable and she has enough staff to actually train, and it'll be somewhere in that 10 or 15 negative range. She'll be able to probably pull that off. But that person has to come within her shop. It has to be a dispatcher, has to be somebody that does that job. So we'll always have that kind of phenomenon.
Let me restate, I guess, my question here. I don't know we actually need a position in the organization, 911, to coordinate the training. I think that what I would say is a continuing education program that's offered to all employees. I just think it's a different way to do this. I don't know we need a coordinator within that department. That seems like a bit of an investment. Maybe not right.
Yeah, I think, and Captain Allen's here from the Sheriff's Department, I think in public safety arenas like the Sheriff, 911, maybe even corrections to some degree, it is so training intensive and so technically intensive on what they do, and the stakes are so high with any mistake made that I think we could have a lively debate about whether that needs to be a full-time, actually dedicated position or not. And I think I trust the department heads to tell us if they need that or not, if there's that many hours of training they have to provide per year. But it's a great discussion back and forth to talk about that.
Sheena, do you have something to add?
I will add that the commission did approve for us to move forward with the learning management system. We will be beginning that process in just a few weeks of creating that for employees. It's an online library system that everyone will have access to with many, many different subjects. So instead of coming to a classroom and learning things in person, they'll have the option to do it online. So just one more aspect that we're trying to get to employees and giving them another avenue for learning different things.
Thank you. Commissioner Cruz?
Thank you. Just real quick. I mean, down the line, I think it's important to have a continuing education person in every single place. And I think overarching, we had talked a while, Tom, we talked about this on Wednesday, about adding in the future, not in this budget, maybe a chief innovation officer, somebody added to the management team that is only looking at innovation and ways to bring our government up to 2022 and beyond, because we are pretty stuck in the past in the ways that we do things because we're so intense in just trying to maintain the systems in which we have. So I have to really encourage us to, the long-term thinking of this is to restructure things in a way that are innovative. We just went to Deloitte the other night talking about innovation and manufacturing. We have to talk about innovation and how our services are provided, and the way to do that is to have dedicated people that are going to be focused on that only. So I hope that we can start thinking about that. Thanks.
Okay. We've had a preview to item 9, so we'll turn it back over to Rusty.
Thank you. Item 9, create ongoing implicit bias training and testing for Giac and JDF staff. So corrections, I believe, has done this training at least once prior. And the $11,250 is something that's within their existing training budget. They would use the previous vendor to deliver this training to each and every employee in corrections again. And it does contain both a teaching and a testing component to it. So it's structured in a way that actually aligns with the recommendations of the task force. It's within their budget, and it's something that they plan to do as soon as it's practical to do it. So it's a funded item, and it's in process. I have pending on there. That was my mistake, but it's in process. It'll be up to Chris and Steve and to determine when it's appropriate to try to schedule and pull that training off based on their current staffing levels. And then item number 10, required
Just a
training.
minute.
I'm sorry.
Commissioner Howell.
Just a couple of questions. You said it's funded. Where's that money coming from?
It's within their training budget. That's my understanding. You want Chris to answer that more specifically?
I'd like to know more about. I guess there's going to be maybe a difference of opinion here, whether or not the Sedgwick Lofton case was racially motivated response, and I'll argue it was not. But the fact that it's on the sheet tells me that people here think it was. So I'm a little concerned that we're talking about this in this discussion, like we have a problem that must be solved. I had to look up implicit bias because it's been a while since I've seen that term, but it means it's automatic and unintentional bias, and we have to assume that everyone, unless you have this training and you somehow conquered this problem, you're going to have a bias problem. It's unintentional and automatic, and that the people who were in this facility that when this incident happened, that's what motivated the incident to go the way it did. And I will handily reject that theory. So I don't like that even on the sheet. I don't know why. The fact that we have HR types of training for all kinds of things that relate to diversity is great. But this is, in my opinion, a misguided statement on the sheet here.
I want to, before Chris answers, as I said at the beginning, these are the task force recommendations. These are not staff recommendations. This is what we heard the task force say, so that's why I made the sheet. Now, whether we need the training or not, I think organizationally, Commissioner, that any large organization, the county is a large organization, can benefit from this type of training to learn to do business better, to be more progressive in nature. Specifically, if this is related to the Lofton matter, I don't know. I don't know what the intention of the task force was to put this on the list, but this is their list, so we felt obligated to present this to the people so that they would hear it.
I would just say that if you look across the literature, get on and Google. In the law enforcement world, and we've got the sheriff in the room, in the law enforcement world, which corrections is taking people referred by the court and on the court's order, in some instances, restraining their liberties or otherwise supervising them and setting restrictions on them, where we're dealing with people in our community of different races, cultures, genders, all of those classifications. It's kind of a standard in this day and age to provide that type of exposure and that type of training to specific law enforcement officers, but other public safety individuals who are government agents of the government and who have some level of ability to restrain liberty and take away people's rights. And I think it's like any training. It's an exposure. It's an opportunity for people to expand their understanding of other cultures and other perspectives so that your staff is not ignorant. I don't think it's directed to say that Sedgwick County is biased or that our employees did anything that was race-based, but I think it's a best practice for our employees to be exposed to the information. And we have to look at the curriculum closely to make sure that it's reasonable and appropriate for our staff.
Well, just a follow-up comment, then when we have a new employee, they ought to go through some type of orientation, I'm sure they do, that kind of covers this type of diversity type of training to make sure people stay professional and don't let their biases come out in the way they treat people in their job. And maybe a refresher is due once in a while, but this is not an issue that's focused on this case specifically or on Giac specifically. This is more of an overarching global strategy that should be employed everywhere in the county, not just here. So again, the $11,000 is to me is just it's a misnomer. Really, it's not the strategy that makes sense here, unless you think that's the only place in the county has a problem and we're going to fix it with $11,000. I'll stop. Thank you.
Okay, do you have something to add?
I do. Chris Morales, Department of Corrections. I would like to just say that on the implicit bias training, we had already started moving in that direction within our diversity curriculum. So prior to our previous director leaving, she had started that curriculum and worked with a vendor to do that, trained all of our supervisors, found such a value in that training that the recommendation was to train the rest of our staff. So this recommendation fits in well with that, and it's something that we already started.
Okay, thank you, Chris. Commissioner Cruz.
Thank you. I think that it's just really important to point out that systemic racism exists in our community, whether it makes us uncomfortable to talk about or not. That doesn't mean that every single person is racist, but it does exist in our community. And so we all should go through implicit bias training. All commissioners should go through it. I mean, all of our staff should go through it. But it's important that we do start talking about it in a productive way so that when things like this happen, we have the information and we have our staff trained in the sense that we can feel good, that we know that it wasn't racially motivated. I don't know that we'll ever know that, but it does exist in our community, and we have to start talking about it in a productive way.
Thank you. Commissioner Lopez.
I'll just add on to that really quick. I do agree that this needs to happen countywide. I mean, this is something that we're talking about with the DEI group that we're working with. So we're already having these conversations about what needs to happen internally at the county. And this is going to be a part of it. I don't think we can speak to what the task force had in mind with this because, again, this is their list, but we need to be sensitive to the fact of what happened and just be really mindful of how we're speaking about the situation. Thank you.
Thank you. Okay, Rusty, item 10.
Item 10, require training at regular intervals regarding mental health, trauma, culture, culture and gender diversity, and implicit bias for all Giac, JDF employees. Honestly, or specifically, if you go through the recommendations, they offer this same recommendation for law enforcement, for DCF, for all the agencies involved, but we're speaking specifically about JDF and Jayak today. In this case, there's no cost listed here, and currently, Sheena spoke about there's currently a HR training module that's under development here in the county, and Corrections indicated that they believe that they could work with HR through this new training module that's being developed to incorporate a lot of to build this type of curriculum and incorporate it so that it's available to corrections employees, but then also more broadly to other employees across the county. And if HR, if Sheena wants to speak to that or not, but Corrections basically says they don't see a cost to this because they believe they can accomplish this in coordination with HR through that training module. So.
Very good. Commissioner Lopez.
Just one really quick question. Did you say, Sheena, that you're working with Hicks Carter Hicks on this training piece? Or how is the training being developed?
So currently, right now, we do have a diversity training that all new hires go through, and then if an employee needs a refresher course, they're able to take that as well. But we will be working with Hicks Carter Hicks according to what we put out in the RFP, and they will be training us so that we can train all of our employees on an annual basis.
And will this go through the process to be looked at every so often as things change in cultures and communities and everything else? I mean, we'll be updating this as we need to going forward, or what would that look like?
Yes, and things like that need to be reviewed. You don't want to create some content and then never change it again. So,
okay, perfect. Thank you.
Thank you. I don't see anything else on that. It's ready for safety and security.
Okay. Item number 11, require a nursing staff position to be present at Jayak JDF. This is a no-cost item. It is funded and it is in process. Corrections, as we spoke earlier, they selected a vendor to continue the medical services at JDF and JRF, which are required by licensure. And that RFP included a requirement for the vendor to provide 24-hour-a-day, 7-day-a-week nursing staff nursing service for JDF in that building. So that will service Giac as well. Obviously, there's a cost involved, but it's built into the contract. And just for your recollection, that medical contract for 2023, the total cost was $792,828, a piece of which is this 24-hour nursing in that Giac JDF facility. Our new vendor was supposed to start January 1, but because of some changes with our current vendor who elected to get out of their contract early, our new vendor will begin as early as September 1st, late August, September 1st. So potentially this service will start this year, fourth quarter. If you have no questions, then I'll move to number 12, establish a calming room at Giac. This also is in process. This construction is underway. It's a remodel of an existing space. It's $7,000, which is already funded. And that $7,000 includes remodel and addition of camera with audio as we move that direction, and then with appropriate furnishings and features that should be in a calming room. And I can't get more specific than that, but.
Commissioner Cruz?
Oh, well, that's what I was going to ask. Can we get a what they would like to know? What a calming room like? Is it a mural on the wall? Is it paint and calming colors and?
Steve Stonehouse from the Department of Correction. The calming room is just exactly what you're talking about. It's something that's not so sterile like a normal cell. It has a mural. It has tactile items if somebody needs to relax or self-soothe or different things like that. More comfortable furniture. Just a place for them to go while they're waiting. That's more comfortable than just sitting in a chair if somebody's having a heightened exposure to being brought in during a stressful situation. Just a more relaxing area.
Have we considered doing more calming things around the whole place in general?
JDF already has, and JRF has calming areas already, so Jayak is the addition.
Okay, great, thank you.
Thanks, Steve. Okay, next item.
Okay, number 13, prioritize in CIP to update video system in Giac and add audio capacity. Okay, the story here is that in 2019, there was a CIP, and we spent $787,000 in 2019 to upgrade that camera system with 154 HD cameras, a network video recorders, new network video recorders that would store about 85 terabytes of data, 14 new 23-inch monitors, 4 new 42-inch monitors, an application server, 14 workstations, and 2 keypads. In 2021, following the Lofton incident, we had to pull one of those recording devices offline and submit it as evidence. The sheriff took it as evidence. So we spent about $33,000 to replace the item that we took offline and to buy a second recorder. So we went from 3 recorders to 5 recorders so that we would have greater capacity for recording, and so that we could also take the 160 cameras that we have in that facility and divide them up between 5 NVRs instead of 3. Again, so we would have greater recording capacity, and also if we lost recording capacity on one, we would not have as many cameras go down. And then in 2022, we spent about $6,100 for some, what I believe is some basic maintenance to software, is what it looks like to me. So we've spent just a little over $800,000 in the past 3 years to upgrade this system. The system worked and did what it was supposed to do. However, this incident was one that was unique, something that we had not experienced and didn't necessarily have precedence or policy on managing. So going forward, we do have a CIP, and the 23 CIP has this item as requested in the CIP. It actually existed in the CIP last year. It had been submitted in response to a PREA recommendation, and we've updated it for this year to add audio to the system. We're still researching the audio qualities. We also reviewed and found blind spots that needed cameras added, and so there's an additional cost for that. The CIP is for $237,542. the cost to add additional cameras to fill the blind spots, the wiring for that, and adding audio to that adds about another 61,000. And so the total amount to do all of that in one fell swoop is $299,517. This item is funded. It is in the CIP currently this year. It was for an outer year, but it's my understanding from our CFO that we could either initiate this year with the CIP amendment, initiate a portion of it this year, or wait until January 1, and with the commission's approval through the next budget cycle, initiate at that point. So.
Very good. So you are working this right now. It doesn't do any good to add audio if we don't know that it works. So we're testing that to make sure that it's intelligible.
Yes.
And we're adding additional cameras.
That is correct.
Commissioner Cruz.
Thank you, Chairman. So how many blind spots were identified?
I don't have the number in front of me. It seems like it was maybe a dozen or so cameras that we are going to add, including into holding cells. There's special types of cameras to put in there where they can't be easily broken. And then in some other areas that would be overhead type cameras that we just realized it would be good to have angles from those as well.
And these are all stationary cameras, they don't move around?
Steve?
Yes, they're stationary cameras. It's not like a TV camera that moves with the voice or anything. It's stationary. That's why we have to have so many to get different angles of one view. The district attorney's office had this recommendation in his report to look at the blind spots. The cell where the incident happened, there was no camera in there. But since that's what's called a dry cell, there's no toilet facility in there. We are allowed to have a camera in there. So we found a flat one that is tamper resistant to be able to put in there and have a better view of what's happening.
Okay, and then as far as the window access, has that been rectified? Like the port that wasn't he trying to get he was trying to pull something through the window access? So
Right.
how has that been? That should be part of this safety and security. I don't see it listed here.
It wasn't brought up by the task force.
Okay, so what will that be secured?
It could be. Those, before COVID, there was nothing there. It was exactly like this.
Sure.
And then when COVID happened, those plexiglass areas were put up. So there could definitely be a slider put in there.
Is it of your opinion that would be helpful?
That's a very popular area for kids to go to when they're mad. So it could definitely be something looked at.
Okay. I think, now as far as the audio goes, I mean, with technology these days, there are audio programs that can pinpoint all sorts of things. I get it that the sound would bounce in that area. I understand that, but
What I've looked at from the 5 detention centers in Kansas plus the juvenile correctional facility in Topeka, you and I talking would be picked up beautifully, but if Mr. Leeds started screaming, then it's very muddled. We have it in our juvenile residential facility, and it's useful to a point, but we have to manage our expectations about how useful it is.
so have you looked outside of the criminal justice system for audio engineers that could help fix this problem so that we could see what was said in the future if this happens?
That's part of the process.
Yeah, we need to look outside of the criminal justice system for those who are utilizing sound in their places. The sound industry is very vast, and so we can't limit ourselves just to the criminal justice system to fix this for us for other people who have used it. So I'd like for you guys to look outside of that.
Sure.
Thanks.
But we also have to make sure that it meets the safety and security of inside the criminal justice system.
Right, but we won't know that unless we start looking outside of it.
Okay. All right. Item 14.
Okay. Item 14 is what I deem to be a community engagement recommendation, and that was to create a database at Giac that identifies grassroots organizations that serve youth corrections, that would serve the youth corrections system. There is no cost to this. Corrections has they have a contract for consultation through Wichita State that they can utilize to help fulfill this recommendation, in addition to working through their juvenile and adult advisory boards and with the many system and community partners we already have. Collectively, we will make sure that we identify, and that includes talking to some of the specific grassroots organizations and having them identify for us who they identify as grassroots. We'll have a comprehensive list. We will utilize that list to maintain regular communications, to share grant opportunities for those who are providing some type of youth services so that they have an opportunity to apply if they wish to, outreach to them for volunteer opportunities, as well as just general communications on reporting out performance activities of the department, et cetera. So corrections believes they have that covered, and there won't be any cost to the department or to the county beyond what we already have in contract. So, any questions on that?
Next slide.
With that, this is kind of a summary slide. It takes everything we just talked about and puts it on one table, and kind of outlines for you what's pending, what's in process, what's funded, and what's not. 10 FTEs is what was asked for over the course of this 14 recommendations, and the total cost cumulatively is roughly $1.449 million to do all of it. And then as we get to the end of this process, I'll show you what's funded and how much is already funded. But with that, if you have no questions, then we will jump into the Substance Abuse Coalition, Health and Substance Abuse Coalition.
Might jump in, Chairman, just kind of talk about the future on this. Now that the commission has been briefed on this, and we'll visit with you, as I said, early next week regarding specifics of budget and what'll end up making it into my recommended budget. I think the next prudent step would I think the city's going through the same gymnastic on that side of the street with this, with the task force recommendations. It might be prudent to have an en banc after the city's process is done as well, and we've got budget set. So there is a similar theme, as Rusty pointed out before, between law enforcement, juvenile services, DCF, and I don't want to get us into a situation with the city where they're doing one thing, we're doing another thing, we haven't cross-pollinated and talked about it and been efficient. For example, of 24/7 mental health response. I know they're looking at that at the city, but it would behoove us, I think, to collaborate with them so that we're not repetitive in our strategies. Just something to consider for the commission.
Okay, thank you. And a major point is that out of 14 items, 8 of the 14 we are definitely working today or are going to be taken care of. The other 6 are in process that we understand what's going on, and we will be putting together a dashboard on our website in conjunction with the City of Wichita so that everybody can follow along on exactly where that we're at on these 14 items. Commissioner Lopez.
Thank you. And actually, just a correction there. One of these was marked as pending when it should be in progress. So we're really 9 out of 14 so far, which is, incredible for the amount of time that we've been working on this. But we are going to try to have an en banc meeting when Chairman Dennis and I have been meeting with the mayor and vice mayor. That's something that's come up every month for the last handful of months. And so we do want to get that on the calendar when we can. And then we're working on the dashboard so we can put this information on what has been asked for and where we're at with the budgetary costs or whatever the case is online, so people can easily access that and see where it's at. Rusty, you've been trying to, and I don't know the status of if it's scheduled or not, but the 90-day update with the task force is coming up at the beginning of August, so we'll be able to speak directly to them. I believe Brandon Johnson and I will be there to talk to them about just an update on where we're at between the city and county and what that looks like going forward, and then we'll be meeting again one more time at 180 days past this, and really see at that time what this task force wants to do going forward, if they want to meet again, if they don't want to meet again, or what that's going to look like. So I know that it was a lot to ask for patience with this process because this was such a hard thing to go through as a community. But I really want to make sure that I thank again everybody who sat on the task force for their time and dedication to our staff, because I know this has been just a ton of work while they were meeting, but even since. I mean, this everything we just went through was so many hours that it took of your time, so I really appreciate that. And I also want to thank the community for having patience, because this is, like I said, it's a very hard thing that we've had to go through, and so I know that change takes a while. Real lasting positive change isn't something that happens overnight, and if we try to do that, then we can create problems that have ripples effects that we don't even know about. So I really am, I'm proud of this task force, everything that they were able to accomplish, and then how seriously the county has taken that. So I just want to make sure that I thank you guys again for all the work that's gone into this. Thank you.
Thank you. And I want to echo Commissioner Lopez's comments. First of all, Rusty worked very hard on this, and he gave us updates constantly, so the commission was always informed on what's going on. Corrections was deeply involved in it. Our HR, a lot of our staff was involved in this. In addition, we had Bothner Bradley that were helping facilitate this project. So I appreciate all the hard work of the task force, but also appreciate all the hard work of our staff and everyone else that was involved to get us to this point. It's not done yet. So a number of the items are pretty well down line, but we still got more to do. Manager Stoltz, is there any other information before we go to the next item that you need from the board so that you can prepare a manager's budget?
No, we'll be speaking with you next week, and I think you've given me good guidance today on how to shape up the recommended budget. I appreciate it.
Very good, thank you. We're going to move on to mental health substance abuse. I want to make sure that I recognize Dawn Shepler, who is in the audience today. She is heading up the Mental Health Substance Abuse Coalition, and I want to welcome you. And we will move on into the next item. We have 8 different requests on this, and Mr. Manager, who's briefing these items?
Well, we'll tag team this between Tim and I, and you will hear from Dawn at some point, I'm sure, and she is here as a subject matter expert to get up and get into the weeds if the commission on any of these 8 items wants to go there. I will cover the first 4 very quickly. I think this will go faster than some of the other recommendations from the previous discussion. Tim will cover item number 5 and 6, and then the sheriff, Captain Allen, is representing the sheriff today. He will cover items 7 and 8. So item 1, very quickly, the coalition, and I might start by saying after the en banc, I think the coalition developed a spreadsheet of roles for the county, the city, and external. This was our list of roles that were given to the county, and it's everything that we see could touch budget. So the first ask from the coalition was for a dedication of $100,000 for the next 3 years to help administrate and run the coalition. Fairly simple, straightforward ask, $33,000 per year. So if there's no questions on that, I'll just keep moving. You stop me if you want to.
Well, first of all, we want to make sure that the city is a partner in this, so it needs to go into their budget also. And the second part of this is that I concur that we probably ought to take a look at the first year. It's just that they've asked for 3 years, and at this point, I need action over that first year to convince me to continue to fund it.
Absolutely. Dawn Shepler with the Mental Health and Substance Abuse Coalition. The city is in agreement, and they are putting this into their budget. They will be working on this coming through for August. The 3 years are to support the efforts, my position in coordinating the efforts of the coalition and the work of the coalition. And the coalition has been running for approximately 2 to 3 years now, and has not had somebody in my position to specifically strategically run point on a lot of these things. So that's what a lot of the funding is going for the first year, second year.
Okay, Commissioner Howell has a question.
Yes.
Well, you actually kind of answered my question. So the city's putting in money equal to the county?
Yes, sir.
And our part of this is $100,000 over 3 years.
Yes, sir. They're both equal.
So it's $200,000 over 3 years altogether.
Correct.
And the intent of that is to pay for a staff person, which would be you in this case.
Correct, as well as other budgetary items.
So in the last several years, the coalition has been meeting, but they've not had a representative, so to speak, that's been a paid person. So this is just changing that by adding an FTE, so to speak.
Correct.
All right. Would this be in our budget or their budget, or both?
I'm sorry, Commissioner.
Would this be in our budget? I mean,
It would have to come from our
the
budget.
City's going to give us money, we would manage this, or?
I think the 33, if the commission agrees with it, we'll put the 33,000 out of our budget, and I assume the city would do the same thing. It would not be one paying the other. We would both be paying the coalition.
Okay, now does this become we've never actually voted to put members on that board, right?
Yes, correct.
And they still meet in secret behind closed doors. They still have never been able to attend and listen to see what's going on. They're not public open meetings. Now we have tax dollars. But you have tax dollars going into this. I guess I'd like to know, is this going to become a public open meeting?
I'm going to have Dawn answer that question too. I think that the meetings, Dawn, are the meetings open to the public when we have coalition meetings?
I am not privy of that, but I can get that information for you.
I've been trying for years to get into this. I don't think so.
Okay.
All right, thanks.
Your point is taken, though. If we start throwing public dollars at it, I do agree, Commissioner, they should be public.
And along with that, again, one or two commissioners have had a chance to participate in this over the years. It's not a community discussion. I think if you want to get the community involved in this community discussion, you've got to open the doors and let people see what's going on. Give them a chance to speak and be part of the conversation.
And I think Dawn knows that, and I think she's going to be working toward
I'll
that.
tell you right now, I'm not going to support this if we don't get the doors open. Thank you.
Let me just clarify, and I agree that we need to have open meetings. As a matter of fact, Councilwoman Tuttle and I just met this morning to make sure that the executive portion of WAMPO are open meetings. And we've drawn up a complete list of requirements on how that we hold the open meetings. And we can share those with Dawn if you want to see, get kind of an outline, blueprint of how to put together the notifications and how to meet and so forth. But I do believe that it's a good idea to make sure that they are open meetings. Again, Commissioner Cruz and I are ex officio members. We are not voting members. I don't make a motion. I don't vote on any of the things that come up before it. We're there to bring the information back to this commission, which we do regularly. And I dispute that it is a secret meeting. Granted, we're right now not doing it as open as we should. I think it can be rectified, and I will provide Don with some guidelines that we've already prepared so that we can move towards making sure that everyone knows that it's an open meeting. The only caveat to that is that two of us do apply to come to the meetings. If a third member of this board ever wants to come, they're welcome. We just have to make sure that we notify communications so that we can show that, again, that we have three members, a quorum. So, do you have a further question before I go to Commissioner Cruz?
I'd like to address that, though, Chairman.
Go ahead, let her speak first.
Okay, Commissioner Cruz.
So, the insinuation and the use of the word secret implies that we have something to hide, which we don't in any way, shape, or form, which is why we have had multiple community updates. Many of the people in this room were there. And to know that you'd like to be on and to sit in these rooms is great. I would welcome you in these rooms. And so let's talk about getting it on your calendar and then talk about notifying the media of potentially 3 commissioners being in the room. There is nothing to hide with this group of people working to reduce the number of people suffering on our streets from addiction, homelessness, and mental illness. There's nothing secret about it. So to insinuate that is very detrimental to the work that we've been doing. And I think that we have all said how supportive we are about moving the needle when it comes to mental health and substance misuse in our community, knowing that the number of people that suffer from this issue end up in our jail. So I would ask you as your colleague to stop using those words, because this is not a secret meeting. This is a very transparent process that we would love to include you in. And so let's make that happen.
Does the public have access to the video? Is there video being recorded? Is it accessible to the public currently? Are there minutes
Of
from the
the-
meetings that I can read?
There are minutes of the meetings, but there is
Are
no,
they published where I can get access to them?
we do not have those published right now.
And why not?
I will have to refer back to
And are
you.
these meetings videotapes where public like myself can access the video and see what's going on?
No, we do not video record those, but we do have our community updates. We're planning on having another community update in November-ish time to relay all of the information, just as we did in the May.
I've
community
attended
update.
every one of the community updates, and I do appreciate those. But again, so the community is very interested in this topic. We keep saying it's our number one priority. And yet, they meet behind closed doors. The media is not allowed to participate, and we can't have a third commissioner in the room because it creates an issue with open meetings, which is why a third commissioner is not in the room. I've been bringing this up for years. So you may not like the word secret, but guess what? It's behind closed doors in a private discussion with minutes and video not available to the public or even another commissioner for that matter. I don't know what you call that, but I call that the word, I think the word secret's a very appropriate word. It's not the way it should be done. If you want to move this issue forward, you've got to get the public involved. They are already involved, but they want to know what's going on. Who's saying what? Where's the money? There was a whole proposal about buying some land downtown potentially. I think the conversation got very mature and find out, guess what? We're maybe on the wrong path. That should have never happened. But how did that happen? Because I think people were misled, or perhaps the discussions got too far down the path and it wasn't exactly the right discussion that should have been happening behind closed doors. But they did happen. So call it what you like. Don't be offended by the word secret. It is simply, I'm using the word in a proper definition. It is a secret meeting. Thank you.
Don, you've got the minutes from all the previous meetings, and
Correct.
you've got a website. Can
Correct.
you add a place on the website that to publish the meeting minutes?
Potentially, I will have to get back to you on that.
Okay. And if you want to see me after the meeting, I'll make a copy of what we put together for WAMPO, and you can kind of use it as a guideline on how that we can make sure that we publish that we're having the meeting and so forth, and that should alleviate all the concerns that Commissioner Howell has.
Yeah. And this is the first time that I've heard that you were interested in the meeting, so.
And just to be clear, I've been talking about this for several years now, so it's not the first time I brought it up. But thank you for clarifying that. Thank you.
Thank you. Okay, item 2.
Item 2 is a dashboard. This is a recommendation from the coalition to fund a dashboard for consumers to find resources. I think that is describes what they're wanting. They want a dashboard on a system to where if I need mental health services, I can go to that site, get a defined and clearly and easily accessible list of resources in the community so that I can reach out and get help. It's my understanding that the coalition has place this item in a Spark application. If that fails for any reason, I think we come back to the drawing board and determine how it is funded. I think county was listed as a secondary funding on that.
Okay, it is going for a Spark application for this, but Don, you just got recently a 501c3, correct?
That is correct.
Okay, so once you get now that you have the 501c3, you can go out and start soliciting funds legally that are tax deductible from the community.
Correct.
And so is that one of your next steps so that, and one of the things that you're going to hear me say a lot, and everyone here has heard me say a lot, you probably haven't, but government can't do it all.
I understand that.
So since government can't do it all, I hope that you're out soliciting some of the funds rather than every time you need something, you ask government to do it.
That is correct.
Very good. All right. Next item, please.
Same item with number 3, same kind of concept. There went 2 community navigator positions to connect people to resources. There's a Spark application in for that. If the Spark application fails, we come back and look at funding. But the same argument you could just make, they could go out and, with their tax exempt status, go out and solicit that money as well. Item number 4 was a gap analysis report on the gaps in services. We did not research that any further. The city manager about a month ago told me he was going to fund that from the city side, so that is no longer a county fund request. Item 5 and 6, I'll have Tim talk about as it deals with technical inpatient services.
Commissioners, for context, the focus of the coalition is on those that are uninsured and underinsured in the community. And the primary funding source for treatment services for substance abuse treatment services for individuals that are uninsured and underinsured is federal block grant money. And federal block grant money goes to the states, and then it is allocated to community providers, and that happens at the beginning of the state fiscal year, so in July of every year. And there's a cap in the amount that's available to spend on these services, and it's not uncommon for the providers to go through the allocations that they have for substance abuse treatment services before the end of the state fiscal year. So oftentimes, providers run out of resources in February, and so there aren't resources available to pay for services between February and June, generally. So the coalition made an ask for additional funding for inpatient services. I added a number here to give you an example of what those types of costs may be. So based on the rate for residential treatment services, 300 bed days could be purchased for $54,000. That could potentially get you through the end of a calendar or a state fiscal year for a handful of patients. So it would not solve the problem, but it would address the problem. And then you could increase that amount to 600, 900. Just multiply by the number that you want to add, $54,000. One thing to consider may be to add this topic to our legislative agenda as well, to see if we could see increased funding available for those providers so that those services could be provided.
Okay, Commissioner Lopez?
Thank you. That's what I was going to ask, is because this is a state thing, why we would be paying for the funding gap that they've essentially created. So if we could look at adding this to our platform going into the next session, I think that would be very appropriate.
Okay, Commissioner Cruz?
Okay, so I don't want to jump ahead. This is inpatient, you're talking inpatient addiction beds.
Residential treatment beds.
So is this?
It's different than the next one, and I'll try and make those distinctions clear.
Okay. Okay, I'll wait till we get to the other one. Sorry about that. Thank you.
Okay, next item.
So number 6 is to fund medical detox operations. In the Community Crisis Center right now, we partner with SAC as our substance abuse provider. ComCare provides mental health services. SAC provides the addiction treatment services. SAC is able to deliver a service called social detox in that setting, and that does not require medical oversight. There are individuals who, because of the duration or the intensity of their addiction, may need medically supervised detox. And so this ask is to fund the staff that it takes to deliver medical detox services. As we've drawn up the potential plans for an expanded community crisis center, we have included space for medical detox, the provision of medical detox services. However, SAC does not have funding, a funding source right now to staff that particular service. The cost estimate from a few years ago was about $900,000. It requires 24/7 nursing staff, and then it requires a physician oversight to deliver that service. So that is the ask related to medical detox. And again, that would be a step prior to residential treatment, for example, that someone receives in option or request number 5.
Okay, Commissioner Cruz?
Okay, so my question is, how many current residential inpatient treatment beds do we have right now?
In the community, the only place
That we as ComCare, we don't, or as Sedgwick County, we don't have any?
there are residential treatment beds in the community. I can't tell you exactly how many there are. SAC's a provider, DECA's a provider. There are a number of providers in the community that do residential.
I'm aware of that. I'm just asking, are there any within Sedgwick County government? There aren't, are there?
No.
Okay. So you're asking to add this as a community asset?
Correct.
Okay. And then the medical detox, do we have, can you get the number of people who are doing, I was just at SAC last week, and so they do 1,200 assessments in the jail for folks that are coming out. How many, and they do 4,000 total for the year, a little bit over actually. So Do we know can you get me the numbers for how many people detox in comp care at our crisis center right now? You don't have to answer that right now to me, but.
I can't.
So what would be the need, and then what would be the gap of and that's what I'm after.
Okay. And one of the distinctions is that we don't do any medical detox
I know.
at SAC right
Yeah.
now. And so that's the aspect. I will find out the number that they're doing detox for.
So success rates with those who have just a social detox, and then success that we could see that we'd have greater success with a medical detox. So if it was available, they wouldn't have to just socially detox, but some people could still socially detox.
Correct. And some people don't need medical detox.
Right.
They just need social detox.
Yes.
And right now, for the uninsured and underinsured, the only place to do that are through the emergency rooms at
Right.
hospitals right now.
Okay. All right, thank you.
Okay, Commissioner Lopez.
Thank you. I just wonder if this is going to take medical professionals that we don't necessarily have on staff today, as we're looking at building potentially CommCare with the Health Science Center, if that's something that we can work with KU and WSU on to see how we can collaborate to get some medical professionals from them to be a part of that. I know that we still have to talk about how funding's going to go with the crisis center if it's on that campus, but I think that would be an important piece to add into the conversation. Thank you.
Thank you. Okay, well, it looks like we're up to the item 7 with the sheriff and 8.
Keith, you want to go? Whoever you want to do? Okay.
Welcome.
Cody Alexander, I'm the captain over special projects in the Detention Bureau. On number 7, and I think I left mine. So to fund the 7 full-time jail specialists, so currently we have a SCORE program in place that is manned by 1 corporal. I'm not sure exactly what the ask is for, whether that would be to grow that program with our current staff or to utilize civilian staff as those 7 people. So I kind of looked at it both ways. A current corporal, the $500,000 cost, we would be, if you use a baseline corporal, we would be just under that cost to continue on with that program and grow it. Obviously, the way that we staff it, it's probably not going to be 7 brand new corporals. So it has the ability to go above and beyond that $500,000 ask. So currently with the SCORE program, which is the Sedgwick County Offender Reentry, they offer classes in AA, NA, substance abuse. They offer services to help get Social Security cards, government issued IDs. They provide guidance on when you're going to get out of resources that are available to an offender upon release. So the issue, we started this program just prior to COVID, so we don't have a lot of data on how the programs works. Obviously, during the height of COVID, for the most part, it got shut down. We weren't allowed to let people in to come do some of the classes, and we weren't able to provide some of those services during COVID time. And we've just started amping those back up again in recent months. Is there any questions on what we would?
Yeah, Commissioner Cruz.
So one thing we've talked about is the time of day in which people are released back into the community. And, if a judge orders that somebody can get out at, June 2nd, are they released at June 2nd at 12:01?
Not necessarily. So we don't currently give exact times. With a 24-hour operation, there's always, you never know what's going to happen. And dependent upon how the order is written from the courts. So if it's they're committed to hours. If they came in at 8 p.m., they may not be eligible for release until 8 p.m. If it's written as days from the court, they could be eligible at 12:01. And then that's going to go into a group with all the rest of the releases for that day, and it's going to come up at basically earliest possible time frame. Now, some of our people, so say if they're in our mental health unit where they're going to be released out to a service, we have those separated out where we may have to coordinate with a outside community partner that at a certain time will either release them to that person. We just notify and coordinate with them so that they can be up there to help facilitate those services upon release.
Sure. So those that are at high risk to go out and use or have other issues, how do you sort of triage them from going out? And where's the numbers of those you release from, services sadly in this community aren't open 24/7, right? We have, our recovery center, it's not open. It's open Monday through Friday till 6 o'clock, right? So if we release someone at 5 o'clock or on Friday at 6 o'clock, they're shut. So they don't have anywhere to go. So are we strategic in how we're handling high utilizers or, high risk offenders that are people who are have an addiction? Are we prioritizing those? How are we handling how we're releasing them in our current state?
So currently, the only ones that would fall into that category would be the ones that are being managed by mental health inside the facility. So the ones that are going to slip through the cracks is somebody that comes into booking, hasn't gone all the way through the process and gets released out immediately. And no, we are not going to hold that person because a certain service doesn't open until 8 a.m. We can't hold on to them and hold them in custody any longer than necessary for that purpose.
Sure, and I understand with, the occupancy of the jail and how full it is, but I wonder if we were able to get the data around who is being released when, what is their risk level for themselves, right? And are services available? Could we see higher or better outcomes for those being released if we were to, would it cost us to keep them less than it costs us to release them and they reoffend or do some other crime and then get put back in the system for something else? So I don't know how, do you understand what I'm talking,
Well, I think,
what I'm asking?
I think you're going to run into a legality question with that of holding someone in custody and saying, I'm not going to release you because I believe that you're have a substance abuse problem and the program for you to get help doesn't open until a certain time.
I'm not asking you to break the law.
Okay.
I would never ask you to do that. But what I'm asking is, are we really being strategic about how we release them? And is there a way to think about it in a different way that will be better for this, for the individual at all? Like, are we thinking about that? And
I think it's something we could definitely evaluate moving forward.
Okay. I'd like to see that happen.
Okay. And then do you want to touch on item 8?
So on 8, the request was to hire a consultant to develop in-custody drug treatment plan. It was touched on briefly earlier that we were in the process of switching out medical providers. One of the things that we did ask for, at least a quote on in that, is the cost of developing a MAP program or medicated assistant treatment. So I do have the numbers on that of what that provider would charge us to do that, and this would be up to 100 inmates. So if somebody comes in with a diagnosed opioid disorder that they're currently prescribed medication for on the outside, we would continue that treatment plan while in custody. And up to 100 inmates, the total cost was about $367,733 annually. The 287 of that would be staffing, and just shy of 80,000 of that would be for the medication itself. My understanding is that Giac will be utilizing the same vendor, so they should be able to provide them a quote. I would assume that their program, their need would be much less than what we would be at the adult facility. So The other thing that we asked for was the cost just to have a master's level AODA counselor or alcohol and drug abuse counselor. And that would be 40 hours a week, full-time, that we would have that master's level counselor to provide services while they're in custody. And that came out to be about $88,233. Those were items that we were not able to include into the current budget that we went with when selecting that provider. But as far as hiring the consultant, unless they were looking at doing something outside of that, the vendor that we're currently using does that same service for other facilities and is able to provide us and incorporate that into the contract that we have with them.
Hey, Commissioner Cruz?
So you said if they come in with a diagnosed opioid disorder, do a lot of people come in with their diagnosis, or is it just a verbal?
Yes, ma'am. So anybody that comes in is going to have a medical intake done. Part of that questionnaire is medications that they're taking or currently prescribed. Obviously, then they'll sign a waiver. We check with their doctor. So it's not just at the word of someone. Obviously, we have to go out and check on that. But if they're currently on a treatment plan under this system, we would be able to continue that while in custody.
But they have to give you access to those records, right?
Correct.
So what if they don't have a diagnosis? I mean, I wonder how many people have gone and received services. Can they be evaluated in this program? And if they are then, can they be diagnosed with that in the jail?
They can.
Okay.
So they would fall more under kind of what our current system is. They would be referred to mental health or through the clinic and go through previous interactions with medical providers or mental health services, and then they can receive a new diagnosis while in custody, yes.
So this program would pay not only for the medication to treat them, but for the diagnosis for them as well?
So the Medicaid Assessment Treatment Program is predominantly geared towards those that are on something already. So if somebody's on a methadone treatment plan going in, typically that's not something that we would allow or continue, but it can be detrimental to end those services. So what this would allow is us to evaluate that and continue services, hopefully keeping that person at a stable level, not allow them to deteriorate while in custody, and then we release them back, hoping that they get back onto that program and stabilize out. The whole goal of it is to maintain that stabilization throughout custody so that they're better off when they're released.
Sure. Yeah, no, I'm 100% supportive of this. You know, with 70% of people having an addiction in our jail currently and 30% with a mental illness, you know, those dual diagnosis, I'm sure you guys have. Well, I went into the jail the other day, and one of the deputies, it was a Friday afternoon, and he was just not happy, right? I mean, there's a lot of things that go on in that jail, and the people that you deal with are very sick, very acutely sick, violent even, right? So how do you feel like this is going to be a game changer for your facility?
I think it'll take a little bit of buy-in from staff, but anytime that we can maintain a level, it's always easier to maintain that than it is to allow somebody to fall off of, you know, just like you or me, if we take medication, we get off of it for a week, we're going to have adverse side effects to that. And then that behavior added to the already volatile situation. So if we can avoid a few of those, I think it's not only beneficial to the inmates that we're providing the service for, it helps out our staff as well. So.
Yeah. Thank you so much.
Yes.
All right, Captain, I appreciate the update. Remember, these come out of the sheriff's budget, so you may want to consider that, but your boss is also the chair of this coalition, so. All right. Let's go on to the next slide, and that's kind of a summary of what the request is. Again, let me remind you also that government can't do everything, and we want to make sure that the Mental Health Substance Abuse Coalition starts looking at funding beyond government. So, Mr. Manager, do you have anything else on these slides before we go to the next item?
That is all for these two items, sir, and I'll give you an option on how you want to deal with the humankind ask. We are having staff next Tuesday, where we'll talk about some aging contingency funding. We could delay that discussion till then. I think it is important that we have the public discussion now. Your call on whether you want to, we're right on time at 4 o'clock, but your call on whether you want to discuss that or not.
Well, I don't know that it requires a lengthy discussion. We'll find out from the commission, but this is one of 2,000 nonprofits across Sedgwick County, and I don't pick winners and losers between 2,000 nonprofits. They have a vital mission, but again, I've said it several times today. I've said it a lot of times in the past. Government can't do it at all, and I don't support the request. Anyone else have any comments? Commissioner Howell.
Thank you, Mr. Chairman. I appreciate the discussion today. We've talked about a lot of really important things, but we've been presented with over $3 million potential request to our budget. And I've said before, I'll say again, that I think we need a revenue stream. I'm not asking for a tax increase. I am saying I want the government to be of the people, by the people, and for the people. You all decide what you want us to do. You want us to do mental health from the government's perspective, then please provide revenue. If you don't want us to do that, then we can keep our government smaller and do this another way. But we keep talking about trying to squeeze these requests and these budget pressures into a budget that's already very thin. And I think we're talking about adding all kinds of new government. And again, it's all well-intentioned. It's a lot of great ideas. But there's not revenue to support these ideas in the current existing budget unless you want to do tax increase. And tax increase means a property tax increase. If we have no other options, and we don't have any other options other than either not do it or property tax increase or talk to the people that we serve. This is your government. Make of whatever you want it to be. If we're talking about new services from Sedgwick County that people want, then you need to support it with your dollars. I'm fine either way. I'm not suggesting we do a tax increase. I am suggesting we ask the people for what you want us to do. And I think for us to find $3 million in the existing budget, and by the way, I'm not convinced that's the right number. And there's all kinds of tangential spending. We're talking about grants that may or may not survive. We're talking about not having 24/7 services. We have human services campus. We've not really figured out how we're going to staff or provide those services. We've talked about ComCare expanding, and we've got positions we'd like to fill. We don't have the money for those, and on it goes. There's just so many pressures in this budget. For us to do what we need to do in the umbrella of mental health is going to require a revenue stream. And so I think we need to ask the people we serve, what do you want us to do? If you want to do this, just throw this out there, a quarter-cent sales tax would generate about $30 million. Am I right, Lindsay? About $30 million. You can leverage that in the private sector against insurance and other things. You might get to $50 or $60 million, and you begin to leverage that money. If you want to provide these services at that level, that's what needs to be discussed among the people. Again, I'm not suggesting that I would even vote for it. That's a decision I would have to make in the future. But I do think we have to put this on the ballot and ask people what they want us to do, because we're just nibbling on the edges here. And if people really want to have this solved as the number one priority of Sedgwick County, then let's do something extraordinary. For us to lean on state and federal government for money is, in a sense, you follow the money. The money comes from us to big government and comes back with strings attached, and we have no control on how these programs are developed. And I'll argue, I know there's data out there, I'll argue that we're the net loser of tax stream. We send more money out than we get back in these grants overall. So if you want to really solve these problems, rather than looking to state and federal government, we should look to ourselves first. And so to the point that people want these things solved, let them prove that by putting a ballot question out there and let them vote yes. Or let them vote no, in which case we are going to leave things in the private sector or amongst charitable organizations or the churches or insurance companies, that we can find other ways of doing this as we do it now and not do a great job. But if you really want to do a an extraordinary program that's comprehensive and has all these different facets to it, a revenue stream is critically needed. And why I brought this up at the en banc meeting. The room was filled with media. I walked out of there, not one elected official said one word to me about that, other than you want a tax increase. That's not what I said. And the media was radio silent. So once again, I'll bring it up. If this is a priority for this community, we need to ask the people for a commitment of dollars to fund these types of big government expanded things. Second, I'll say this. This is the same government that right now we are understaffed in almost every area of Sedgwick County. And to think we can create these positions and fill these positions with money that we don't have, it just seems a little bit of a pipe dream to me. We have, at state level government, we have all kinds of evidences of things that are dysfunctional. And I'll argue there's dysfunction at the county level as well. We're not doing things as good as I guess see a funny look out there. Tag office, and I understand that's a state office, but people, if you don't get in line by 7:01 a.m., you're not going to get something done that day. That's just one example. And I love the people involved in our tag office. I'm not trying to pick on them. I'm just making a point that administratively we've got challenges, and it's not like these are easy things to solve. Do you think we can solve mental health problems in Sedgwick County with $3 million or whatever? It's just it's nonsensical. I can't find a better word. If you really want to solve these problems, it's going to require a real commitment of new money that currently is not happening. So I'm tired of the idea of thinking we're going to just nibble at these things. We're going to comprehensively solve these things with our existing budget using property tax dollars. It doesn't make sense to me. Thank you, Chairman.
Thank you. Did you want to address the humankind question?
I'm sorry. I was waiting to the end to make those comments. The humankind, again, I don't think it fits our budget this year. I just think that out of the thousands of charitable organizations, they came to us one time, they said, I suggested, I don't know if this isn't going to be one time, they said, we know, we're going to come back to you again later on. The budget is so challenged this year. We have challenges like we've never seen before. I've been in elected office a long time now, and I'm telling you, it's not a budget like this one. This is unique and different. We're not going to find that type of money in the budget. To me, it's easy to come ask, but honestly, this is not the right place to get those funds. So thank you, Chairman.
Thank you. Commissioner Lopez.
Thank you. So I don't know if we are trying to get an idea of where we're all at with some of these asks, so I'll just go ahead and let you know where I'm at with this. I do think if we fund the Mental Health and Substance Abuse Coalition, it should be for the 1 year at $33,000, and then come back in a year now that you're here in this position to show us, what the return on investment is for that. Because as you heard, our budget it's rough this year, and we really need to be realistic at what we can and can't do. And there's a lot of asks on here, and expanding government at a time where we're having to close some of our services right now because we just don't have the staff for them. I agree. It's really just nonsensical for us to be able to think that we can add on to something that we're just struggling to maintain as it is. So I think going year to year, kind of like we do with TCAM, and seeing, what comes of that, and if our money is really able to move the needle in this, and I wish you all the best in fundraising for everything else. But I do think that we have to be really fiscally responsible this year, especially given the challenges that we're facing. So I would agree to that. I don't know if that's where everyone else is, but that's kind of what I think would be something I'd be comfortable with. As far as the humankind ask, I'm also not comfortable putting it in as an annual reoccurring cost, just because, again, we're facing just incredible challenges in our budget. I don't know if that's something we can look at as like a one-off at some point, but I think giving everything that we're seeing, all these asks that are coming in, and what we're facing this year, it's just going to be really hard to add something onto that outside of what core services we already provide. Because if we can't provide those, we had to close one of our Giac, areas already. So what does that look like if we keep extending ourselves further and further? And so I do think we need to be as responsible as we can this year, and then potentially looking at something next year if the forecast is different. But that's where I'm at today. Thank you.
Thank you. Commissioner Meitzner.
thank you. There's been a lot said today. Thanks to everybody for all their hard work that they put into this, both these coalitions. I'm very pleased to know that the community task force has already implemented some, if not most, and it's in the process to implement the majority of those recommendations. That was, again, my thanks to the task force and the staff for the hard work there. And the mental health environment coalition, I guess I'm supportive of $33,000 for another year to see if something can happen. Maybe it's closer than I'm sure we're closer than we've ever been, because when it first started, we weren't very close at all when we had 80 profit, nonprofit, and government agencies in one room. And I told Sheriff Easter and Mark Bennett, I said, there's no way anything can get done with this much. But it has come together better. And so I'm supportive of funding that part for another year. But the other items are well, you call them pending. I would say I'd rather wait and see. So, and then a lot of respect for what Humankind does, and I know they're in the middle of a lot of things they're doing. We've just helped them last year, kind of all of a sudden for the winter time, and I think they were very grateful for that. I'm sure they were. So I would at this point I need to pass on that. I need to know more. Just a number request without really knowing what it was all about is something that I need to would have to understand much further to be supportive. So thank you for letting me say a few words.
Thank you. First of all, I want to again thank the task force for the work that they did, and I appreciate all the work that the staff went through to bring us the requests. I think we've given the manager an idea of where we're at with the staff, with the task force recommendations, and I'm very happy that a number of those recommendations are some things that we're going to be able to work immediately. A lot of them are long range. The mental health substance abuse requests, I do support the $33,000. Beyond that, at this point, I don't think that our budget can withstand much beyond that, honestly. I did email you an electronic copy of the things that we came up with for WAMPO. So while we were sitting here, I remembered I had it on my phone, so I just sent it to you. Sedgwick County, really, our mission in life is to provide service to the community. That's really what we do. If someone picks up the phone and dials 911, they want somebody to answer the phone. They want that operator at 911 to dispatch Kevin Lanterman or some of his folks from EMS or fire or police or sheriff. And if someone's in crisis, they want us to be able to go to have a place at our community crisis center or with our mobile facility to be able to respond. If you're a senior citizen like I am, you want senior services if it comes up. If you have someone that's disabled, you want services. That's what we do. But our budget is limited. My first priority, and then, since our entire mission is to provide service to the community, is that we have to have staff to provide those services. So honestly, if you look at everything I've said this year on the budget, my first priority is to that staff to get them the compensation that they need to retain the staff that we have now and to hire the staff that we need in order to fill these hundreds of positions that we have open. So we're working on that. A vast part of our budget is going to be involving getting our staff the compensation that we need in order to retain them and to recruit new ones. So as far as a lot of requests from the outside, you're not going to see me voting for a budget if the manager brings me a budget with a whole thing, a lot of items that are outside of those things that are needed for us to provide the goods and services for our community. So I look forward to what the manager now comes up with after hearing all the discussions today and all the discussions that started way back in February. We've been working on this budget, and we've had more meetings on this one budget than I can recall any time in the time I've been on the county commission. So And that goes back to all the folks in Lindsay's department and the rest, the 40-some departments that we have here that have worked hard to bring all of the different requests to us. And we've heard those, but we can't do it all. This is probably the fourth time I've said it today. Government can't do everything. So we're going to do what is most important first. And we're not going to be doing things that are not going to meet our primary mission, and that's provide the services to our community. So, Minister Cruz.
Thank you, Chairman. So with this budget, Lindsay, would you mind coming to the podium? So we have to keep a 20% contingency, right? What's the statute?
Minimum fund balance.
A minimum fund balance of 20%. Right now, we're at what, 38%?
That was at the end of 21, yes. Our budget went up for 22, so it's slightly, we don't have 37% anymore, but we're close.
Okay, so when we talked about this week, if we took 1% of that contingency fund, unused fund balance, what did you call it?
Fund balance.
Yes. That would be roughly around
$370,000.
$370,000, and we'd still be sitting with a very healthy fund balance.
Yes, ma'am.
You know, right now, our systems are so interconnected. Folks who are on the streets right now end up in our jail system, in our criminal justice system. And folks that are on our streets, I just spoke to a lady today. She's been arrested 3 times this week. So now whatever her problems are her problems, right? But she is accessing our services. She is being picked up by law enforcement. She is going to our Sedgwick County Jail. So when we talk about the services and how they are interconnected and how they're woven together, it is the responsibility of Sedgwick County government to work within all of those systems. I do believe Humankind's ask is important for us to fund, and I am supportive of that. I didn't get a chance to say that, so I will say that now, because they do serve the population of people who in which come to our jail. They do have case managers. They do meet with those folks on an individual basis with their supportive housing up on 9th Street, Broadway, and I think it's 10th Street, the studios. That's a 90% success rate. We could fund something that has a 90% success rate in getting someone into housing. That's important for our system. So I am supportive of that, and I'm supportive of these other requests as well, because at the end of the day, we have to stop just simply maintaining a system that keeps that revolving door spinning on the axis in which it's just being greased. So that's my comments about this budget. I mean, we have to start thinking in a different way, and if we do have a healthy fund balance in which that we could pull some of that from, I think that's what we should consider doing. Thank you.
Thank you. Well, thank you, Lindsay. But if you bring me a budget that has deficit spending, I probably won't vote for it.
Noted.
Any other comments from the board? Well, again, thanks for everyone that's been in the room today. We appreciate it. And again, I've said it a number of times, thanks to everyone that worked on this and everything else that's gone into the budget that we're going to vote on August the 25th? 4th. Okay. With that, we're adjourned. Thank you all.